Hi, this is NiEtta, and you're listening to The Health Show. To The Health Show. And you're listening to The Health Show. And you're listening to The Health Show. The Health Show is a podcast dedicated to connecting individuals to mental health resources in the community. The Health Show is more than a podcast, it's a movement focused on change. Our objectives are to change the perception and visible stigma associated with mental health, remove barriers to mental health resources, address the needs of the underserved and the challenges they face when attempting access mental health resources, spread awareness on how to access mental health resources in the community, and encourage those with mental health diseases to seek help. The Help Show founder, NiEtta Reynolds, hosts our first Coffee and Conversation virtual live podcast addressing how to maintain your mental health while social distancing. Our co-host, Dr. Kenneth Rogers, and our special guest, Michelle McKamy, New York City Director of Home Care and Hospital Mission for Health Pro. Join us on the virtual live podcast to answer your questions about health and safety during the novel coronavirus pandemic. Michelle McKamy spoke with us about care for the elderly and those with compromised immune systems, as well as ways to stay engaged with people who need us the most. We're committed to supporting the mental health needs of the community during these challenging times. COVID-19 has changed the world in a short period of time. The Help Show is here to help you navigate through the changes and address your mental health needs. In part 1 of this month's episode, learn about the importance of taking this pandemic seriously in order to prepare for difficult times ahead, including by staying home to help stop the spread of the virus, as well as ways to cope with stress. This podcast shows us how to interact with others while social distancing, manage your short-term and long-term stress, support your children through the changes in your daily routine. Join us for part 2, link to the other video of this important podcast to learn how to support elderly, stop the spread of the novel coronavirus, and use telemedicine to manage your physical and mental health care needs.
So the question, if anybody's having trouble, is how many people do you know affected by COVID-19? 0 to 3 people, 4 to 9, 11, or more than 11.
Oh, wow.
I think that, Dr. Rogers and NiEtta and I have had a conversation that what's affected by COVID-19 means a lot of things to a lot of people.
Absolutely.
It's an interesting question because we said affected, not diagnosed. And so that's actually a very broad question, intended to be very, very broad. And I'm not sure whether folks can see the results or not, but about 62% were between 0 and 3, and 24%, 11 plus. So I think that, the vast majority of people have had some effects, but not really a whole lot. But again, I think it could be related to the question and the way it was done. But I do think that it is very anxiety provoking, especially with the 11 plus people affected. That's a pretty big number.
I think so too. I think it's a huge number. But you know what? I'm happy that the numbers that are 11 plus and other that are higher are are lower. So that made me that are at 24% and 10%. With all the infections that are going on, in Texas and New York and southern states. So I actually thought it was going to be higher. I thought that it would be at least 10, and that's like 0, and I'm absolutely shocked.
Well, I think something, I being in New York, sent out the invitation to people that were in New York. So what you may be seeing is we have 45,000 cases in our state, and you guys have 427 cases in your state.
Right.
So currently, right now, and let me tell you, I remember when the number was 400. And we were like, wow, that's a lot, because New Rochelle is small, and holy cow, it started with one guy and it spread. So I can't tell you like how quickly that number gets bigger, and how important it is that we do abide by what they're saying about sheltering in place. And I don't know if you guys heard, but basically, as soon as I arrived in Texas, Governor Abbott went on and told everyone that now anyone coming in from the tri-state New York area was going to be on mandatory quarantine, and you were going to have to register. So, I mean, I just barely slipped in under that. So I think when you're talking about what does that mean by affected, for the people that are in New York, we're literally talking about patients, friends, clients that have it. When you're talking about a number like 45,000, and for the rest of the people, you know, I think what's important, and what I'd like to lend it back over to Dr. Rogers, is that you know, affected could mean literally sick. It could mean scared, especially children. I mean, the news is terrifying. You know, when you listen to the news, it sounds horrible. And now all of a sudden children are stuck inside. And being for 3 weeks, I have a 3-year-old, being in a house nonstop with a 3-year-old, not able to go outside. And, you know, it's hard not to watch the news every day, because every day the number gets bigger. You know, whenever we first started working around this idea of this meeting, Dallas had 95, and now you have 425 in a very short period of time. And that's scary for people. And I know that Dr. Rogers, dealing with the psych side of healthcare, can really kind of attest to, you know, what that is for children. And I'll actually leave it to the expert, Dr. Rogers.
Dr. Rogers.
Well, you know, I think the interesting thing is it's interesting with the way the question was asked, but I think as I kind of reflect on it a little bit, when we think about kind of personally affected, we think about, you know, does somebody I know develop the virus? Are they actually sick? And I think we kind of leave it at that. But when we start to think about the bigger question of what we're talking about, we're really looking at a society that's really under a lot of stress right now. And so I think if the question was, how many people do you personally know that are anxious, that are uptight, or out of school, or out of work, having financial trouble, you know, dealing with kids being stuck inside the house all day, who have their own fears and anxieties, I think that question would be answered very, very differently. And so I think that, you know, COVID has been about the virus itself and whether people are having symptoms and going to the hospital and getting a diagnosis. But I think the bigger issue for most people, and will be for most people, is how do we weather the anxiety, depression that's going on with us being inside of our houses for so long, or having a spouse, a kid, a family member who's out of work, thinking about where our next meal's coming from. As you look on TV, you see, you know, schools are opening because kids don't have a way of eating their next meal. So I do think that it's affecting us in ways that will really carry on for a generation. So we're going to see a lot of, you know, after effects for this for a number of years, especially with our young people.
What do you recommend for parents that have small children at home that are able to actually work from home, and them dealing with the stress at home? Like, how can we help children cope with being stuck inside, understanding, you know, social distancing?
You know, the biggest thing I remember learning and training was the best thing to raise a healthy child is a healthy mother. And so if we can get mom being less anxious about what's going on, and to truly not be anxious, because kids are going to pick up, you know, emotions a lot quicker than adults will. So even if you're trying to hide it, it's still going to come out, and you're going to pick it up. And so I think really being able to put some of this in perspective, just like we got through Ebola, just like we got through swine flu, just like country got through Spanish flu, eventually at some point on the other end, we're going to come out of this as well. And so we have to think about, what is life going to look like on the other side of where we are, and really beginning to focus on that versus what's right in front of us today.
So the question I have for you. We're talking about all this stress because what's going on is that everyone on this phone call has some type of stress. Okay, which you said, if it's from financial, if it's from medical.
People are losing their jobs.
And it's serious. And so what I want to do before we go into our next question, this is doing good. I'm going to do a poll. And the poll is on a scale from 1 to 5, how many are feeling anxious and about the pandemic? 5 is that you're very anxious or feeling anxiety or anxious. 4 is like, okay, it's to 5. 1 is like, I'm not anxious at all. I'm cool and collect. Let me sip my glass of wine.
So Dr. Rogers, what do you recommend for our number 5s and our number 4s about how to deal with stress other than alcohol, as we just discovered, as far as like just dealing with this? Because social distancing often sounds like social isolation. And what we know about stress is that, your relationships that you have or your support system. So what is your recommendation to our audience about how to deal with the stress?
It's interesting. So the whole idea of social distancing has been fascinating to me because supposedly I've been socially distant this past week, but I've talked to more friends that I haven't talked to in the past year, in the past 2 weeks, than I would have ever imagined. Because people are actually getting on the phone and talking to people because they're stuck in the house and they decided to call. But that then makes me think about the folks that may have been socially isolated to begin with. And if you're a person that's been socially isolated, haven't had those relationships, now we're really stuck in this place where we don't even have the casual, relationships, the person you run into in the grocery store and have a conversation, the person sitting in the restaurant you have a conversation with, or the coworkers at work that in many cases kind of become the de facto family for a lot of people. Many of those folks are taken away. So the first thing I would say is to really think about who are the people that are meaningful in your lives and how can you find other ways of connecting with those folks.
Something that I thought was really interesting, Italy actually has been really hard hit. I don't know if you guys have watched any of the things that were happening in Italy, but it's really, really sad. Unfortunately, their outbreak started with a major soccer match. And so when that first, as you would call it, ground zero patient went to a major, a gigantic event and infected a lot of people really fast. So the numbers climbed rapidly. They also have a much older population than we have in the United States. And so literally they are having issues with the deaths related to this. And it's a very sad situation right now. If you watch any of the things that are going on in Italy, they're actually recently they've decided that they can no longer provide life support for anybody that's over 65 years old because their cases are so high and their ERs are so overwhelmed that they just medically they have to make decisions on who is has a higher likelihood of surviving, which is your younger persons that have less comorbidities, right? So if you have underlying heart conditions and things like that, which most of our elderly population are, that would have to be eliminated. But what I thought was really moving amongst all of that is the people in Italy, because they couldn't reach out, were going out onto their balconies at night and they were all singing together from their balconies. So they had been isolated in their homes and they really are being just stricken with this disease right now. And yet they are still finding a way from across the aisles and across the balconies to reach out and just let their fellow man know, I'm here. And I think it's important to talk about what social distancing really is, because I know it, whenever I flew into the airport here, like I said, 3 weeks ago, I was the naysayer. It's just the flu. It's no big deal. I don't know what everybody's worried about. They just said it's a light cough and a fever. I can get through that, no problem. And then when the numbers started, growing exponentially, and all of a sudden we're in lockdown, and now we're in lockdown and we have a curfew. We have to begin at 8 p.m. And now, you know, all of a sudden we can get a ticket. We can be taken to jail if we don't abide by this curfews. As Americans, we've never experienced things like that before. So it was really kind of eye-opening and scary to think about it. And we really didn't know what that was, but very quickly we started to learn. And so I would love to be able to pass that on to all my Southern Texans, or if you're in North Carolina, or wherever you're listening in from, of what really social distancing is and what it means. Because whenever I came out of the airport, I saw people high-fiving each other. That is not social distancing. And you have to understand the etiology of this disease and how it's passed. So if you can be passing the virus, and it's highly contagious. So you can be passing the virus and have little to no symptoms for several days. That's a big deal, because the people you're infecting, the people you could be harming, are the people that you love the most. And every time we touch things that are communal, like doorknobs, counters, you know, anytime you're going into an elevator and you push a button or a building, understand that virus can live on the surface of items for up to 3 days. So to really be safe in social distancing, you want to be, like I said, 6 feet apart. And you still can go outside and meet each other. You can still talk to each other, but not close.
So I have a question for you and Michelle and Dr. Rogers. Since you guys are working in the hospital, what challenges are you personally seeing people due to the COVID-19, and how are you helping clients and patients overcome them? Dr. Rogers?
Well, you know, one of the things I try to do with folks is I try to put COVID into perspective. We've got to, you know, do common sense things, social distancing, you know, stop shaking hands, stay away from people to the extent possible, and all those things we really need to do. But the other piece of all this is there are a lot of other ways that you're more likely to die than COVID. More people committed suicide last year than will ever die of COVID. More people died of the flu last year than will ever die of COVID. More people died of high blood pressure, cancer, et cetera. I mean, you can go down the list. So what we're talking about is a relatively rare event. And by relatively rare, I'm talking compared to the big things that kill people. And I usually talk about that mainly because it deals with the anxiety of where we are. Because the more anxious you get, the less you're able to kind of reason through and rationally think about things. The vast majority of people, if you practice social distancing, you do good hand hygiene, you try to avoid, you know, touching your face, you do all the social distancing things that we're talking about, and you really take care of yourself, your chances of actually dying from COVID are relatively low. Might you get sick? Might you contract the virus? Absolutely. But I think having that perspective as to what it really is becomes extremely important, because that then begins to fan out to your children, to your family. Because if mom becomes over the top anxious that my child's going to die of COVID tomorrow, then that's going to affect how she's going to relate to her kids, what's going to happen in terms of them being able to engage with other people, and can actually become unhealthy and more socially isolating rather than socially distant. Social distance we can handle. Social isolation becomes much more problematic.
Dr. Rogers, how will we help children with ADHD, anxiety, and depression late? Because what's going on that I was reading this article, if you continue to watch the news instead of 2 hours a day, people watching the news 10 hours a day. So if you're watching the news 10 hours a day, you get all this negative feed. All this negative feed is going into your children, and your children are like 8 years old talking about pandemic, which they don't even know what that is. And so how can we help the children with ADHD, anxiety, depression, and as well help the parents kind of navigate from watching so much television with so much negative feed about what's going on with this pandemic?
So I think about my son when he was younger, and he used to have his Xbox Live. and he would basically play games with his friends who were around the country that he knew from places we had lived before, that he still had relationships with, because you have the internet, you're playing games, you're getting together, you're doing stuff. Many times we as adults haven't really lived in a world where we can live electronically and have electronic relationships that are real, and we're engaged just as we would be otherwise. And so I think on the other side, there are things that we can learn from our kids. With kids that have, ADHD, severe anxiety, other mental health issues, it becomes a real challenge, because at some point in time, you have to kind of weigh to yourself, what is the biggest issue that I'm going to have with this kid's in the house and isolated with just me and the child, versus what would happen if I had a play date with another child. And that's an interesting conversation that I've had with parents of how do you begin to weigh those two things out. And there's not really a lot of guidance from what we know out there that really begins to answer those questions for us. We talk about, staying 6 feet apart. And for a child that's, 6, 7, 8 years old, they can begin to get the whole idea of distance. They may not do it, but they can understand it. You get an impulsive kid that has hyperactivity, the likelihood of them staying 6 feet away from somebody is really very, very low. And so I think as parents, we have to think through, what do we do in situations like that? And do we have play dates with other people? And are there ways of having safe play dates with others?
One of the things that happened, and it didn't start the first week, it really actually started about a week and a half in. Avery school, my daughter's school, they were closed down, and they're toddlers, so they really don't understand a lot of what's going on. And our school actually started doing Zoom meetings, these type of Zoom meetings with the kids, so that all the parents could log in with their kids, and they read a story together, they do their alphabet and some of their songs together, and then they get a moment to talk to the kids that they're seeing, because their routine is really disrupted right now. And I would like to just, to all the parents out there that their children are not in school, they're going to be emotionally unstable for a little bit. They're going to complain more. They're going to have more emotional outbursts because everything they know is just completely disrupted. So that's one of the really cool, innovative things that has come up that, in my knowledge, has never happened before. In New York, classes are still going on, but everybody's on tablets and they're having to do it from home. So I'd like to say, as you guys are sheltering in place, to really start being innovative and looking at Zoom and other things to be able to reach out to maybe multiple classes.
So we talked about studying with the kids. So we talked about how we support the children, but how we're supporting the parents. So I'm rewinding. We talked about, jump roping with the kids, telehealth. Are we doing the same thing with the parents, or because the behavior from the children are coming from the parents?
Well, it's a really interesting time, because I think about, faith communities, for example, and the number of people who find a lot of solace in, I'm going to show up at church every weekend. There are a group of people there I talk to. There are other social things that people do that they do on a regular basis. I see friends, I'll go out to dinner, etc. And most of that's gone away. So people are really having to think through, I have to really shift my paradigm with how I relate to other people. I think about, I was talking to my daughter recently who lives by herself, and she's like, I realized I haven't actually seen a person like alive in real space in like a week and a half.
Oh, wow.
So it can really be isolating, especially if you aren't going out and you're taking the shelter in place thing very seriously, because you can be in a situation where you aren't seeing people, and electronically may be the only thing that you've got.
I'd like to comment on that really quickly, that our elderly population, I want you to think about somebody that that is elderly. They are less likely to be inclined to have access to technology or to be able to engage in technology, because maybe they don't have a desktop or iPad or a laptop.
Yeah.
And then, with this isolation, they're also the most vulnerable population. So what they hear is, yeah, that's great for you, young person, but if I don't isolate myself, this is a death sentence. I mean, the statistics get much higher when you're over 65. You really have to take into consideration of your fellow person. So, you know, if you do have an elderly person in your community that you could maybe support, the least, you know, you can do is just reach out and see if there's okay. If you could go and get items for them to decrease their risk, wipe them down with like Clorox wipes and leave it on their doorstep for them, and just, you know, those type of things really go a long way. And our elderly community, like I said, is the most vulnerable of our community, and they really do need our support right now.
What you guys are describing is that social distancing may become the norm after this, pandemic is over, or, you know, once we get it under control.
I'm not God, so I can't say how long. I think only higher powers out there can have any idea of what the future holds truly. I mean, I don't think Italy ever thought they would be in the position they are. I think New York never dreamed.
Absolutely.
I mean, let me just paint a picture really quick. Times Square, I think everybody has watched the ball drop in Times Square. Times Square is pretty full all the time. There's never a time. It's a huge tourist, 24/7. Doesn't matter what holiday or what day. If you come up out of the subway in Times Square, you're going to bump into somebody on the street. It is vacant. It's unbelievable. It's unfathomable how much the social norm has changed and what has changed in that sort of thing. But I would like to just tell the audience that if we look at the demographics that came, at the statistics and the path that this disease took in Wuhan, it took 8 weeks for them to get through it. And it's not a matter of will we not contract. Staying in place is not preventing you from getting this.
Right.
Staying in place is slowing it down. The ROT score, the rate of transmission, is 2.6. And what that means is whatever number you see today, so I think you guys have 276. I want you to go ahead and multiply that times 2.6. And that's the real number of the virus that's out there. It's still in the no symptom stage, but it's viral and it's still passing.
What I will say, just looking at what your question and statement is, NiEtta, I do think that's very important. So I'll put some of this in perspective. So I've been on a number of conference calls. One of the things that Dallas County has done an incredibly good job of is looking at what's happened in Washington State, looking at what happened in New York, and beginning to learn a lot from what was going on around the country.
Much earlier.
And Dallas has been, I must say, I've been extremely impressed with the city leadership, with the leadership at Parkland Hospital. There's really very, very clear messaging of what needs to happen next. And behind that has been a plan for how do we think through a lot of this. So at Parkland Hospital, for example, there's a command center set up. The command center has big meetings twice a day. There's always somebody in the command center. It's monitoring everything that's happening in the city. It's monitoring the number of beds. We have quickly put things into place to be able to really do very good surveillance, especially with Dr. Wong from the health department. So there's been a lot of coordination in Dallas that's really helped us avoid so far some of the things that we're seeing in a lot of other big cities. I'm very, very hopeful that we'll be able to have the bed capacity, the ventilator capacity for those who actually get very ill in the county, and we'll continue, pushing forward to make sure that people are as safe and as informed as possible.
I want to know who's actually practicing social distancing, and when we do the Q&A, I want to be able to know why. And also, when we get done with this social distancing, I want Dr. Rogers and Michelle to really explain what is social distancing, because I think people really don't understand what social distancing is. And when we finish the poll, I want Dr. Rogers and Michelle to explain it. And I might retake the poll to see if the answers have changed, because I'm curious.
While we're taking this moment and people are filling out this questionnaire, I just want to take a little deep dive into what a little more scientific about what the disease is. So you hear corona, and I think it's important to understand that corona actually means crown. We've all seen this really interesting picture of this virus, and it has the little pokies that stick out everywhere, for a non-scientific definition, that create that crown. And I think what's really important to understand about what this social distancing and why it is and why this disease is so contagious is that it has a little like an oily shell around it that protects it. And so oil, as you guys know, is the fat is sticky. And this is why it will stick to surfaces. It'll stick to your skin. It'll stick to your hair. It'll stick to your dog. It'll stick to your Amazon package. And it can stay for a really long time. So one of the most important things, and I couldn't say this enough, is wash your hands. People in New York are running out and buying, alcohol off the shelf. Healthcare workers need alcohol because there are situations when we walk in, especially home care providers that go into a patient's home. There are instances where we don't have access to water to be able to actually wash our hands. So healthcare workers need that alcohol. Every other person in the world needs to be using soap and water. It literally is the most effective thing to kill this virus. Soap or any form of detergent is going to break apart oil. And when you do this, even if there is leftover virus that is stuck on your hands because you didn't get good underneath your fingernails or whatever, the detergent, the soap, is going to break apart that oily protective shell, and it's going to expose the virus. And the virus life, that 3 hours or 3 days that it's able to live normally on the surfaces, it decreases significantly. You need to make sure that you're also washing your face, and that you do not touch your face without washing your hands. I got onto NiEtta the other day because she's constantly fidgeting with her glasses, and I'm like, the average person touches their face 2,000 to 3,000 times a day. You have to wash your hands, and do not touch your face until you do wash your hands. And at the end of the day, wash your hands and then wash your face.
Helpline. Seek help when needed. If distress impacts activities of your daily life for several days or weeks, talk to your clergy member, counselor, or doctor, or contact SAMHSA helpline at 1-800-985-5990. The crisis worker will work to ensure that you feel safe and help identify options and information about mental health services in your area. Your call is confidential and free. Crisis text line, text NAMI to 741-741. Connect with the trained crisis counselor to receive free 24/7 crisis support via text message. This podcast is produced by NiEtta Reynolds, Ben Fenton, Nicole Smith, and Davian Abney. To get your very own beats, email davianabneymusic@gmail.com. The Help Show is a nonprofit organization. To learn more or donate, please visit www.thehelpshow.org. Or you can also Cash App # The Help Show to send your donation. There's no donation too small. Every dollar we receive will strengthen our efforts. If you'd like to donate $1,500 or more and become a VIP sponsor, visit www.thehelpshow.org to review additional packages with more detail. That's www.thehelpshow.org. Follow us on Instagram, Twitter, and Facebook at The Help Show. Remember to subscribe to the podcast. Please leave comments. We want to know what you think. Thank you for listening, and please stay tuned.